My name's Erin Reinicke. I'm the social worker at the Southwest Health Center Nursing Home. I've been here for, well, actually my anniversary is tomorrow, 9 years that I've been at Southwest Health Center. I'd say my primary responsibility is to advocate for the residents, and I do that by, in the admission process, by working with them and explaining the process of being admitted. I do that by explaining that they still have rights while they're in the nursing home, and by reassuring them that we do take their care very seriously. We want them to feel respected, and we want to respect their dignity. I do that also by helping the families, because sometimes it's a very hard process to admit your loved one to a nursing home. And I do that by also helping them through the financial process, applying for medical assistance, explaining the Medicare process, and things like that. I went back to school actually when I was 33. I went to college and I went to UW-Platteville. I have a bachelor's degree in psychology with a minor in criminal justice, and by the time I was finished with my second internship, I knew that I wanted to stay in long-term care, and so at that time I put an emphasis on the human services side. I did have to go back to school for a couple of classes before I could take my testing to get my certification, but I did that probably 2 years after I graduated. I was actually successful in being certified. I've learned that I really like an atmosphere that is more of a people-focused, not money-focused. While I realize that no business can operate without funds, I really appreciate the fact that that is not our primary focus. Our primary focus is on the person, and secondary is on the finances, to the best of our ability. I don't feel like I'm coming to work. I never feel like I'm coming to work. There are days when I wake up and I think, oh, I'd like to just stay home today, but it's not because I dread going to work. Coming here is like, just for me, is like going to someone else's home and spending the day. It's not working. When we turned over to resident-centered care, when we made the transition from the institutional model to the resident-centered care model, another lady and I went around and we did interviews with a lot of the residents, and I will never forget that. Some of the things that we learned, we laughed, we felt sad, right along with them. And then we presented that video to all of our staff. And so many of the staff came up later and said, now I understand why she feels this way. Oh, I feel so bad because I didn't understand that they had this life before they came here and everything that they had to give up. So I'd say that's very memorable to me, to know that it had that kind of an impact on our staff.